I'm going to go ahead and get started knowing that we have lots of people that are joining us today. I want to welcome and thank you for joining us. If you're here to learn more about early signs of autism and developmental delays, you're in the right place. My name is Michelle Quickstead, and my role at the Minnesota Department of Health is to coordinate early identification and intervention activities and lead the follow-along program. I'm going to put in the chat a link to the follow-along program, just in case you haven't heard of the program before. You're going to want to find out more about it. For those of you who may not be familiar, it's one of Minnesota's 6 public screening programs to support early identification and connection to supports and services for young children and their families. It's free. It doesn't have any eligibility requirements, so it might be something that would support the work that you're doing. If you're wondering, what are the 6 developmental screening programs? I just put in the link to that information as well. In partnership with our colleagues at the University of Minnesota and the Department of Human Services, we built out a 6-part series that focuses on developmental screening, monitoring a child's development over time, and early signs of autism and developmental delays. Thank you for joining us today. The picture that you see on the screen is what we typically would see for a March in Minnesota, a little bit warmer than what we're expecting. Our session will be recorded today, and at the end of the session, you will have a survey for you to fill out with a certificate of attendance and an opportunity to register for the remaining sessions if you've not done so. Next slide, please. For those just joining us, I'm reviewing our goals for today. We'll be talking about how to support early monitoring for child development over time, the importance of promoting routine screening. Research has shown that identifying developmental concerns early results in better outcomes for children and families. Recognizing early signs of autism and developmental delays will support the needed supports and services for children and their families and caregivers. Next slide, please. Our hope is that you will learn and you'll leave your time with us today looking forward to the next topic in our series, as we move from questions and concerns about a child's development to supports and services for early intervention. The strategies and resources in this professional development series have been designed to support concerns for a range of needs, from children and families who are mildly impacted or may require more intensive supports and services, as well as for families that live in rural communities, as well as the metro. Our presenters will share strategies for overcoming barriers when participating in early childhood activities and what families can do while they wait for an evaluation and interventions. Later this summer, our colleagues from the Minnesota Department of Human Services will be here to share information about the early intensive developmental and behavioral intervention benefit, otherwise fondly known as EIDBI. This is part of Minnesota's healthcare program. The purpose of the EIDBI benefit is to provide medically necessary early intervention services for people with ASD and related conditions. Our intention when building out this series was to have an interactive model. The positive response and enrollment in this series indicated that many people are eager to receive the information, so we moved the series to a webinar format today to accommodate the interest and not limit attendance. Next slide, please. The size of our participant list for today does not change our focus for you to participate and share with us your questions and needs you have in supporting children and families impacted by neurodiversity and developmental delays. Zoom has a question and answer option that you will find at the bottom of your screen. Just take a moment and look at the bottom of your screen and see if you can find it. We have a visual here. We see an opportunity in the future for more regional, smaller group out conversations as needs and resources arise. Next slide, please. Here's our agenda today. Doing a brief introduction now, and then we'll invite our presenter to talk about a topic. We have a family story to kind of think through what are some experiences or typical examples that we often encounter as we're working with families. And then there's our chance to have the discussion. It'll be more of a one-sided discussion where Dr. Hall-Landy and I will be facilitating questions and answers from the chat, or not the chat, the Q&A feature that I just talked about. And then we'll wrap up and talk a little bit about the upcoming sessions. Next slide, please. I'm honored to introduce our presenter today. Dr. Jennifer Hall-Landy. I always call her Jen, so it's hard to say out her whole name. Dr. Jennifer Hall-Landy is a researcher and a psychologist at the Institute on the Community Integration, otherwise known as the UCEDD, and the Masonic Institute of the Developing Brain at the University of Minnesota. Her work focuses on early signs of developmental delays and early identification of developmental disabilities, such as autism. Dr. Hall-Landy leads multiple disability-focused studies, including the Minnesota Autism and Developmental Disabilities Monitoring Network and the Minnesota ACT Early Project. Not only is Dr. Hall-Landy a champion for early intervention and diagnosis, she is also an amazing human, and I have the privilege to work with her on a few different projects. So let's take it away, Dr. Hall-Landy.
Well, thank you, Michelle. I appreciate that nice introduction today. And I wanted to welcome all of you here today. It really is a privilege to present to a group this large and with this much experience in early childhood. So thank you so much for joining us today. And again, Michelle, thank you for doing an overview of the series. We were really excited when we put this together. Because we thought there would be interest, but we weren't prepared for how many people were really interested in talking about early signs of developmental delays, how we identify developmental delays, and even more specifically talking about early signs of autism and early identification. Before I sort of launch into my topics today, I just wanted to share a few things. I'm on the University of Minnesota campus, as Michelle shared. I'm sitting right at the Masonic Institute for the Developing Brain, which is a relatively new institute on the University of Minnesota campus. For those of you who know the campus, it's on the River Road. For those of you that haven't been here yet, you're welcome to come visit. But it really is an institute looking at, with a lot of different researchers, practitioners, psychologists, physicians, really looking at early brain development from the earliest ages, even some prenatally, and looking at it across the lifespan. How do we understand the development of the brain, child development, early developmental milestones? And all of us together, working together on research projects, outreach projects, and things like today, where I'm happy to be out with all of you in Zoom land, I know, not in person, to share about some of our work. And just a little bit more about it. And I know a lot of you work in this space, but here at the Masonic Institute of the Developing Brain and the Institute of Community Integration, where I work under two research institutes, we're really dedicated to fostering healthy brain function for children, adolescents, teens, adults across the lifespan. But today we're really going to talk about those early years. We think about the first 1,000 days as a critical time for children's brain development. There's a lot going on. Research tells us that about 80% of a child's brain development occurs within the first 1,000 days of life. Our brain is constantly changing and evolving, and it really makes those first 3 years an important or key time for early identification and early intervention. And I'm going to talk about that today through the lens of typical development, developmental delays, and then autism. So I'm excited to have all of you here today and excited to share. And as Michelle shared, today will be sort of a grounding day in information. We hope in the future for a lot more interaction, because we really see knowledge as bi-directional, that I share some of my work, Michelle shares hers, and then we hear from you about what you're seeing out in the field and what your questions are. And as Michelle shared, we had a really, really positive response, to the point that we needed to do this in webinar format, because we had so many people. We wanted to include everyone. So today will be a lot of information, but in the future, in the future, as in the end of it, you'll have a chance to share in the Q&A. But then we're hoping for some sort of targeted groups, smaller groups, where we can do more of an interactive. But welcome again. We are so happy to have you. So today's objectives, like anyone in the field of special education or any other field, I have having objectives for today. I am going to talk a little bit about the importance of early identification of developmental delays. I'm also going to talk about the prevalence of developmental delays and autism. So I am going to share a little bit of the research, what the research says, some of the research from our department around the prevalence and the numbers. We're going to talk a little bit about the early signs. We're going to talk about developmental monitoring. And then one of our goals, Michelle and I's goals for this, was to really give you a lot of resources resources. I know I always want to leave with resources and some strategies that I can employ in my practice. So at the end, we're going to be sharing a lot. So a little bit of research, and at the end, a lot of resources, followed by a case study, and then some discussion time. All right, so I will launch into it. So, and I know I'm probably preaching to the choir a little bit, but I talk every day about the importance of monitoring development, that it is so important as parents, as childcare providers, as healthcare providers, that we're always monitoring a child's development. We're watching for those developmental milestones. What we know is that developmental delays in early childhood are really, really quite common. When I talk about developmental delays, I'm talking about any type of a delay. So we might be talking about a speech or language delay. But what the CDC says, the Centers for Disease Control and Prevention, that approximately 1 in 4 children are at risk for a developmental delay. 1 in 6 will wind up with some type of a formal diagnosis of developmental delay or disability. And what that is, again, when we think about speech and other things that we bring in, we see how common it is. I bring that up because for those of us who work with young parents, young families, people new to systems, and we're talking about routinely monitoring a child's development, that developmental delays are a normal part of neurodiversity within early childhood, frankly, beyond early childhood, but that we're seeing it a lot. And we know because the brain, the early childhood brain, is so malleable and so receptive to intervention that if we are seeing delays, we can get in there with services and supports as early as possible, because it really is an important and unique time to intervene. So you will hear it all throughout. It is really the thread that will go throughout all of my slides. The earlier we identify and connect to services and supports, the better the life outcomes are for children. And some of the research, a lot of the research says the better it is for families as well, because they get in, they get services, supports, they feel empowered, they feel like they're doing things to support their child. Another, and I almost forgot to include it because I work in autism every day, but sort of a brief definition of what autism is. It's a neurodevelopmental disability. What that means is we typically see it arise during early childhood. We see these developmental delays. So it's present in the early developmental periods. We may not always fully see it in more subtle presentations, but we're saying that it affects development, and presumably we see it occur during development. I'm trying to break down some of these words that we just use all the time. It involves, and I am significantly shortening the diagnostic criteria here. And certainly I can put the full diagnostic criteria in if helpful. But what we really see are challenges in social communication and social interactions. Additionally, with autism, and this is one of the hallmarks of it, we often see repetitive behaviors or narrow interests. So that is sort of a working definition of autism. I am going to be talking today about both autism and developmental delays, but I wanted to start with the definition. Again, this is a grounding, this is our intro so that we're all on the same page. So a few trends. I'm going to talk a little bit about the research in terms of prevalence, but a few of the trends. We know that autism, if you were here and I would say, how many of you feel like the rates of autism have been increasing since you started your practice or what you're observing? Autism is the fastest growing developmental disability in the United States. And because of that, we know there's a great need for autism services and supports. And we also know, as I said in an earlier slide, that early identification is important to support the child's development and to support the health and well-being of their families, to get them in for services and supports. What I'm going to talk about today, the research part of this, is I'm going to share a bit about a project that I co-lead called the Minnesota Autism Developmental Disabilities Monitoring Network Project. It's a mouthful, it's a lot of words, and I will try not to speak in acronyms, but we tend to abbreviate that to the ADAM network. And what that network does is it's in Minnesota, we're lucky to have it in Minnesota. We don't have it in every state, but where we track rates of autism, the prevalence rates, what we're seeing out in the community. And then we also are able to contribute to the larger national rates of autism prevalence. And some of these may look familiar to you when I share, but I'm going to give a quick research overview to ground us all in the prevalence rates we're seeing out in the community. Couple things to know about the ATOM network. And Krista, I may have you put the full spell out of the ATOM network in the chat so everyone can see it. It's the largest ongoing project for tracking autism in the United States. It describes the population of children with autism. It compares how common it is in different parts of the United States, and it provides information on the age of identification. We're going to talk about why that is so important in autism. We want to get to kids as young as possible. And so we track our rates of autism identification, and then we identify trends over time. So I'm going to first talk about national data, and then I'm going to share Minnesota. So I'm going to start like a funnel. I'm going to talk about what we're seeing across ATOM sites in the United States, and then share what autism looks like in our own state. So I'll start nationally. What we know, and we look at 8-year-olds and 4-year-olds, but today I'm just going to share 8-year-olds. What we know from the national data from the CDC is that approximately 1 in 36 8-year-old children in the sites they looked at were identified with autism in the ATOM network. So we're looking at percentages, if we roughly look at that, at around 2.8%. And I'm going to compare that to Minnesota's in a bit. I'm going to cover the national data first. If you take a look, and I think this slide is interesting, if we take a look, the ATOM network, the National ATOM Network, has been collecting autism prevalence or collecting rates of autism since the year 2000. That doesn't seem that long ago to me, but I know at this point it's a long time ago, right? I'm not sure how many of you can remember the year 2000. I do, and I can't believe we're in the year 2024. But anyway, when we looked at the rates, when they originally started collecting, we were seeing rates of about 1 in 150 in the populations they were looking in. Just to be honest and to be a good researcher, some of these sites have changed over time. But if we're looking longitudinally, if we're looking back in time retrospectively, and then looking across years, we see this trend that in 2000 and 2002, 1 in 150, and then we see prevalence steadily increasing as they collect it to the point we see the number that we just shared, and that was study year 2020. Our next most recent prevalence numbers will be coming out soon, but that is, we're looking at 1 in 36. So that's quite the change from their original data collection in the year 2000, which I think is interesting to look at that. Many of you, myself included, I remember when we were looking at those rates. It feels like a long time ago. All right. Another question I get is around gender breakdown. And so nationally, we see when we look at autism rates in our communities, we're seeing males were about 3.8 times more likely to be identified with autism than females. I will tell you, and I usually get questions if this were open, how was it measured? It's measured currently. We're looking at what we are seeing out in communities. So this is a reflection. I do get questions, should we be identifying more females? And my answer would be probably yes, we need to look at that. We need to look more closely at why these numbers look this way. But this is simply a report of what we're seeing in communities. And we've seen it across time, a pretty robust finding of the 4 boys, 4 males to 1 female. This actually went down a little bit. And so we're watching those trends, and we'll see what it looks like in the next national data. I'm going to talk a lot about this today. When we look at our median age of identification, we're seeing nationally about 4 years, 1 month. And I'm going to talk to you today. That might seem young to you, but what we know in the field, I'm going to share some information a little later, we can identify kids with training reliably around 2 years, between that 2 and 3 year mark. And so when we see 4 years, 1 month, we really feel that that is later than it needs to be. And that is our charge for all of us that are interested in this field, who have family members, who work as clinicians, who work with families. How can we all work together to bring down that age of identification? Additionally, and there's a lot on this slide, a couple things that we saw. By age 3 of the children who were later identified with autism, about half, a little less than half, had an evaluation recorded by 3 years of age. We would expect that to be much younger. And what we don't have in here is often when we look back at records, we see that there were concerns early, well before the 36 months. And there's a lag in terms of when we're getting to children with evaluation. So now I'm going to come to the Minnesota numbers because this is a webinar for Minnesota. So I'll share with you what it looks like in Minnesota compared to the national rates. So take a look. Our numbers in Minnesota when we look at 8-year-olds and autism, and we were in select counties. I should be clear, in Minnesota, we looked at Anoka County, Hennepin, and Ramsey, so 3 of our most populated counties. We'd love to be across the whole state. We would need to expand the study by quite a bit more, but we would love to be in Greater Minnesota. I know a lot of you on the webinar today are from Greater Minnesota, but for what it's worth, these numbers, we see that about 1 in 34 8-year-old children in the counties we collected in Minnesota. So it's a little, it's a little bit higher than national. We're looking about 3% in the population we looked at. So what that tells, and for those of you that have heard me speak before, when we look at numbers like 1 in 34, we think of the average 3rd grade class. We're likely going to have, based on these numbers, at least 1 child with autism in that class. That is very different than, for example, when I was in 3rd grade, which at this point was a long time ago. When we look at this, it tells us that autism isn't necessarily a low incidence disability, but again, we're likely seeing it. Many of us have family members, friends, classmates, colleagues that have autism. And so it really highlights the need of why we really need to be increasing services, supports, and early identification. Here is this breakdown between males and females in Minnesota. We are actually looking at a rate of 4.3 males to 1 female with autism. And so ours is actually a little higher in terms of that ratio. And we can talk more about that. And I have a little more later in the presentation. Unfortunately, I like to ask the question when it's a live audience, do you think we are doing better than the national average, or do you think our age of identification is later? And if you remember nationally, 4 years, 1 month, we're looking at 4 years, 11 months in Minnesota. So that's almost 5 years. And this is telling us that we're likely not getting to kids until almost their 5th birthday. What happens around that time? They start kindergarten. So for a lot of children, we aren't getting them to services until around the start of school. And for those of us that are early intervention, early childhood providers, we know that is too late. We really want to get in that birth to 3, birth to 5 years with services and supports. Now, some of these children may have been served under developmental delay, but many of these children need specialized services and supports around autism. So we really want to get to kids and families earlier. And again, we're seeing even lower rates of an evaluation by 36 months. So as research should do, it gives us knowledge and an area where we can improve and hopefully move the needle on that of getting kids into evaluation earlier, getting them connected with clinical services and supports. One thing we do know from our data, and I didn't want to go too deep into it, we do know that our schools in Minnesota, compared to nationally, we actually assess a lot of kids. And when we look compared clinically to educational eligibility, Minnesota was one of the higher where children were receiving their autism eligibility, their autism services in the school. So we do a good job with that, but there's always room to do better. So what we know, and again, I'm a broken record, but early identification is critical. We know that intervention at any age or supports at any age is a gift for any child who needs the services and supports, but the earlier, the better. We know it's more effective and less costly when provided earlier. And we know that children can be reliably identified with autism from, we say sometimes up to 18 to 24 months. And I'm thinking of that clinically in terms of those of us that are trained clinically to really work on early identification. So this is just a slide that I have, and it relates to earlier when we're saying we're really getting to kids, particularly in Minnesota, around 5 years of age. Could we really try and move the needle to 3 years? Getting them into services and supports, autism specialized services. And we know that it's within our ability and range 2 years. And I have entire presentations on that, but today I'm just sort of going to scratch the surface a little bit on some of the early signs of autism. And just a little bit more, I know I'm really hitting it home, but we know that really we can have a strong impact with services and supports before age 3.5. We know there's significant changes in the brain. We know from a lot of the research they've done, we can have significant effects on cognition and language. And we know those have a cascade effect on development. So if we're working on those with early supports and services, we know we're going to have a broader, more global impact on a child's development. This is interesting, but a lot of the research that does economic modeling, if you're interested in policy, this is a little kind of policy aside. Research tells us the cost of lifelong services and supports could be cut by as much as 2/3 with appropriate early diagnosis and early intervention in autism. So we have a ways to go on that. But we definitely know, I mean, for those of you who work with young children, you know that it is a time of significant change in terms of language, cognition, social skills. The earlier we can get in to provide those services and supports, the better and greater effect we have on the child's overall development and frankly, the trajectory of their development. But you're probably, maybe, I can't see your faces, you're probably saying, but there are challenges to it. And I agree. I've worked both in clinical settings and in school settings. And there are challenges with early identification of both developmental delays, but I'm going to kind of narrow it in on autism since that's our topic of focus today. But it can be hard to diagnose early. We are looking in terms of research, but there is not one clear biological marker. So we look to behavioral observations. Really, that's a lot of psychology and a lot of educational assessment. We're not doing blood tests, right? We're looking at behavioral observations. Subtle signs come early. And one thing that we're seeing, they come early and it unfolds on the first years of life. We may not fully see it until later, but it can have a cascade effect on development. We have a lot of brain researchers here at the Masonic Institute. I am not one of them, but what they tell me from their work with brain development and brain scanning, maybe we can invite one of them to come in at some point. This is not about that specifically, but in their looking at brains of babies and baby siblings of children with autism, autism can be hard to detect for them prior to 6 months, but by 12 months, they are seeing some signs. And we can invite one of them to come in. But certainly, we're still reliant on behavioral observations, clinical observations, classroom observations, checklists, things like the ADOS, the Autism Diagnostic Observation Schedule, in terms of seeing if a child meets criteria. Oops, sorry, I'm having a little bit of a hard time pressing the page turn. That said, clinically speaking or observationally speaking, there are some early signs of autism. And I want to tell you and I want to caution you, not one of these alone means a child has autism. We really look at a combination or a constellation of symptoms or signs. And for those of you who do assessment or diagnosis, you know that we're looking at a lot of different characteristics to make a final decision. But here are a few that we know clinically and from the research that can be early signs: not responding to name by 12 months, not pointing at objects or showing interest by 14 months. And none of these are set in stone. Think of these like a range. No pretend play by 18 months. Avoiding contact and wanting to be alone, trouble understanding emotions, delayed speech and language. That is the biggest referral, even for more broadly developmental delays. And we certainly see that within autism. Repeating words or phrases or echolalia, upset by small changes in routines or transition. We hear that a lot from families. Intense focus or interests, some of which might seem unusual to some of us from the out, hearing about it, for example, things like elevators or vacuum cleaners or something very, very narrow. Some of those movements, repetitive movements like flapping hands or spinning in circles or unusual sensory reactions. Again, we really view it as a combination or constellation of symptoms, but those are some of the early signs that we look for. So as promised, I'm not just sharing research and information, but I'm also sharing resources. So I shared a bit about the prevalence numbers in the Autism Developmental Disabilities Monitoring Network. I'm going to pivot a bit to our Minnesota Act Early project that really does a lot of outreach and provides a lot of materials and resources to help our three primary audiences are healthcare providers, parents and families, and childcare providers. But really, it's available to anyone, and really to help provide resources with the to promote early developmental monitoring and early developmental screening. So I'm going to talk a little bit about our national program. I call it Minnesota Act Early, but Learn the Signs Act Early. My colleague Krista is going to put the website in. It is a site filled with lots of materials and resources, free materials you can order that help parents and childcare providers and people that work in the lives of children birth to 5 monitor development. And when we talk about that, and you probably heard me talk about developmental milestones earlier, but we really want to get into the practice of routinely monitoring development and checking for those developmental milestones. Those are the skills such as taking a first step, smiling, waving bye-bye. We look for it as parents, we look for it as clinicians, and as we integrate developmental monitoring to our parenting or in our professional practice, it really gives us the tools to support and understand development, but also particularly think of as a professional to talk to families about development, what it looks like if children are meeting their milestones, if we're seeing delays, and how to get them in for services and supports. So these are all free. If you look at the CDC website, CDC's milestone checklist, we have these for lots of ages, and I believe my next slide, 2 months, 4 months, 6 months. They really correspond, and you can download all of these, use them for free. You can access them electronically. They correspond with a lot of the well child visits. We have them in multiple languages. They're really helpful in helping to monitor development and identifying delays early. And again, helping to facilitate a conversation with families around development and meeting milestones. If there's one thing you do, and Krista's going to put another link in the chat, the CDC's Milestone Tracker app. We don't want paper from a lot of parents out. We want things on our phones that we can access. This is a wonderful app. It is free. It is not loaded with advertisements. It's in English and Spanish, and you download it, you put the name of a child in, and it will help track their development. It will give developmental activities. It will help prepare lists of questions before well child visits. If the tracker app sees signs of delays, it will talk through that. It will show pictures of what milestones look like. It's a wonderful app with a lot of capabilities, and I highly, highly recommend it to parents, families, that childcare providers share it with their families. It's a wonderful tool for monitoring development. We also have pictures on the website of milestones in action, seeing what it looks like, not everything, joint attention, looking off to the side, looking back, referencing a caregiver. All of those things we have pictures for to share with families if you're working in a professional setting, or if you're a family and want to see what a milestone looks like. We have wonderful books. Many of you, if I was in a room and say, how many of you have used these? You can order these books through the Learn the Signs Act Early. They're wonderful books on Baby's Busy Days for 1-year-olds, Where's Bears for 2-year-olds, Amazing Me for 3. They're wonderful books that take you through the journey of development through a story. Families can read it with their children, and it also connects to different developmental milestones we would expect a child to be demonstrating at that age, as well as connections to services and supports. These are excellent books, and I highly encourage you to check them out. Watch Me Training, another resource on the website. This is a resource helping provide training. We hear from a lot of childcare providers or people working with families that it's hard to talk about delays in development, not just autism, but general delays. This gives a walkthrough in terms of strategies and tools of how to support encouraging families to monitor development, but also if you're seeing delays and how to approach it, and resources. And it does give contact hours credit. It used to give CEUs. It may or may not still, but you can watch it from the comfort of your home, wherever you like, and get knowledge as well as perhaps some contact hours in terms of your relicensure. I encourage you to check out the Minnesota Autism Resource Portal. That's an excellent resource. It just has a wealth of resources for families and professionals if you haven't already been on it. And that will be shared more in detail in some of our later sessions, but I definitely wanted to plug it for a place for resources. They have a portal postcard and they have a pathways document that shows how to guide a family through step 1, step 2, 3, in terms of initially getting connected with services and supports, accessing diagnostic next steps in terms of service and supports, just a wealth of materials that I can't really get to all today, but we will talk about in later sessions. For those of you who work with families, the University of Minnesota, our department, in partnership with the Department of Human Services, worked with families and cultural communities. And this is on the autism portal. There's also a link here in terms of accessing early supports, support services, early identification of autism. It's across 5 different cultural communities. It's our Somali community, Hmong community, Latino, Latina community, our American Indian, Native American community, and our African American community, what families' experiences were with early identification and how they connected with services and supports. They're excellent. I encourage you to take a look, and you can share these with families. If you thought this was interesting and you want to take a deeper dive into CDC's autism diagnostic, the Autism and Developmental Disabilities Monitoring Network numbers across the United States, and Chris is going to put a link in the chat for you to take a look. This does a deep dive and it gives an individual profile of each state that's part of the network, which isn't all of them, but I encourage you to take a look. If you thought the Minnesota numbers were interesting, I encourage you to visit our Autism Developmental Disabilities Monitoring Network within Minnesota. And there is the website here, and Chris is going to put that in there, and you can learn even more about autism rates in Minnesota. I just brushed the surface. There's a lot more there. So with that, I'm going to turn it back to my colleague, Michelle, who is going to share a family story where we take some of these concepts and share a story about a family, and then we can talk through and come up with ideas of how we would support and help this family. So Michelle, I'm going to turn it over to you. And I just want to thank everyone for listening. Thank you so much.
Thank you, Dr. Jennifer Hollandy. What an amazing amount of information that you packed in so succinctly, and all of those great links in the chat. So if you haven't just clicked on them and then save them in your dashboard for later, there are just lots of great resources for people who are supporting children and families. I'm going to talk a little bit about a story here to highlight, right? The family stories are why we do the work. But please know that the story we're sharing today is fictitious and it's based on a collective of experiences. It does not share any private data or identifiable information. And so once I go through the story, keep in mind some of the experiences you had, and this will lead us next into our conversation. So keep filling the Q&A, please. That really helps us think about how we want to design this conversation for the next 20 minutes or so. So Miguel is a 30-month-old child who lives with his parents and maternal grandparents. Miguel has a younger sister that is 2 months of age. Miguel's grandparents live with the family. Currently, his grandparents are taking care of him and his sister during the day while his parents are at work. The family is close-knit and bilingual, speaking both English and Spanish in the home. Miguel has cousins both in Mexico and in the US, and the family enjoys visiting them and spending time together. Parents describe Miguel as a sweet and kind boy. He loves water play and has strong gross motor skills. He is not talking a lot and uses some single words for preferred items and enjoys playing alone with his alphabet toys and blocks. He often lines up his blocks and sometimes lies down to peer sideways at his blocks after lining them up. He has challenges with transitions to and from preferred activities and sometimes tantrums when his routine changes. Miguel also engages in some repetitive hand flapping, especially when he watches TV. He does have some sensory sensitivities to textures. He is described as a picky eater and only eats a few select foods, including chicken nuggets, applesauce, and one brand of strawberry yogurt. Miguel's parents have indicated some concerns about his development. At this point, they felt he should be talking more, but he is their first child, so they weren't sure what to expect. At a recent family reunion, one of his same-age cousins was talking more and interacting with other kids, and mom and dad became worried. Relatives have acknowledged Miguel seemed younger than his same-age cousins, but also said Dad was late to talk and soon seemed fine now. So the dad seems fine now. Miguel just started an ECFE class and his mom once a week with his mom once a week, but the kids are different ages, so it's hard to tell. But Miguel also seems behind. His ECFE teacher is new and has noticed Miguel seems delayed in his development compared to other children, but is not sure how to address this with his mom. When the parents talked to their pediatrician at the 2-year-old well child visit, the pediatrician did not seem overly concerned. His pediatrician recommended to wait and see, given Miguel is a boy exposed to 2 languages, and that by the next visit, they should check it out again. So we're going to add some questions into the chat, and I would love for you to take some time thinking about the story or other experiences that you've had, and how would you approach this situation? When we think about the questions, what strengths does Miguel and his family bring? What are the concerns do you see in his development? What would you recommend to the parents? Should they wait and see? What if the parents want to wait and see? And what could the family do while they wait? What are some resources? So go ahead and start adding to the Q&A and let us know what your thoughts are about the content that Dr. Jen Hollandi shared and some of the questions related to the story. Dr. Hollandi, there are a couple of questions in the Q&A as we're waiting for others to add. When we're talking about a diagnosis before the age of 3, is this only looking at the medical diagnosis or the education diagnosis as well?
That's a great question. Thank you for the question. So I should have been clear in the numbers that I shared. If that's the first question, I'll answer this in a couple different ways. That was clinically. That was a clinical diagnosis we were talking about, but we also know that a lot of children, particularly in Minnesota, are served through an educational eligibility within the schools, right? I'm assuming many of you are from the schools, as well as possibly some early childhood organizations that work closely with schools. And so when we talk about some of these diagnoses, we're talking about a clinical diagnosis, which we know gives us access to a lot of clinical supports and services. For educational, we're seeing certainly younger. It doesn't reliably calculate all in terms of the MinAdam network across each state in terms of educational eligibility age of, and I'm talking about schools when I talk about that. But what we know is that a lot of the kids are likely getting served under developmental delay, which is definitely a good thing. And we want to see more of that. But we also want to see for those that need specialized services and supports a younger age of clinical diagnosis. We likely will be having a later session where we talk about those sort of different pathways, right? That we have the educational eligibility of autism and we have the clinical eligibility and clinical diagnosis. There have been pilot studies trying to look at ways to merge those two systems. We know they're separate systems and we know it's challenging for families, right? Because they'll go through one. For example, they may go through clinical diagnosis and then have to go through the educational eligibility in the schools or vice versa. So definitely that is a challenge we know of in the field. But I think if we look broadly at both what we see in educational settings as well as what we see clinically, we want to bring that age of identification down. And I'm going to take a look at a few more. Michelle, I don't know, since I'm sharing.
Yeah. I guess the other thing that I would add too is that school districts are really looking at educational criteria rather than a medical diagnosis. And so schools really work in partnership with their partners, whether it's clinic or whether it's county agencies.
Yep.
We've had some people talk a little bit about making a referral to Help Me Grow, which is the online portal to connecting families to their local school district's early intervention program. That's a great thing to do while you're waiting to find out about that medical diagnosis. So if you're a pediatrician or a healthcare provider is not sure about what to do next, we encourage you to reach out to your local school district or make a referral through the online portal, otherwise known as Help Me Grow.
We also will be having a later session on waiting lists, because I would be remiss if I didn't say that when we talk about clinical diagnosis, there are long waiting lists, and many parts of the state and many parts of the country don't have easy access to getting a clinical diagnosis. So we are going to talk about some of the strategies for families at a later session. I don't remember which one that was, Michelle, but when we talk about some strategies for working with families on waiting lists, what we can do in the meantime,
Mhm.
you have these
Yeah.
steps.
Yeah, we'll talk a little bit more about the upcoming sessions. What we're hoping in the design is that we would go over the prevalence data. What's the numbers that we're seeing in terms of children that are being identified, and just really talk about the benefit of early screening, early identification. And then over the next several sessions, we'll talk a little bit more in depth about the details and the resources. So keep those questions coming. Dr. Hollandi, I'm looking here in the chat about strengths. One of our respondents or participants talked about they live with the parents and the grandparents, has a medical provider, attending ECFE classes. These are all strengths. And what Dr. Hollandi and I love lifting up is how do we focus on what the family does have and how do we match that to supports and services? Parents are thinking about how the child is doing compared to his peers. That's also a strength. The parents are really thinking through that and wondering about his limits in food choices or repetitive movements in speech. Dr.
Sure.
Hollandi, would you add anything else to that?
Yeah, absolutely. Those are all right on, both the strengths, because every family, every child brings strengths, right? We want to start with that. As we honor neurodiversity, we want to talk about the strengths as well as the needs. But yeah, we see many concerns with Miguel. Um, First of all, his delayed language, that is significantly delayed language. And that is something that we see coming a lot. Really, if we think of autism, but also more broadly, developmental delay, that is a common presenting concern. The sensory issues, someone tapped in, the kind of restricted food interests. I guess if we were in a room together, I'd say, how many of you have kids that fit this? And it's chicken. I feel like chicken nuggets is the one that that is brought to me all of the time. I don't know what that is, but just highly restricted. The very very narrow interests in terms of what he'll eat, what he's interested in. Um, I'm wondering how many of you saw the sidelong peering of the blocks, the kind of lining them up methodically and then looking at it side, some of those are just, again, not one, and this is a good example that it's not one symptom or characteristics, but it's all of it together that's painting a diagnostic picture or an educational eligibility picture in terms of, where his needs are. I do think it's great that he's an ECFE, but it sounds like from this that the teacher's a little afraid to bring it up and start that conversation with mom. So I would say you should check out the Watch Me training on the CDC's Learn the Signs Act Early website. That'll give you some tips on how you start that discussion with families. Well, what were
Uh,
you thinking, Michelle? What stood out to you?
Yeah, in terms of what are the strengths, I think again, whenever a caregiver, whoever spends the majority of the time with a child has questions or concerns, lead with that, right? We want to talk about the strengths and surrounding that child and that family with what they have that we can match with what the questions or concerns are. But too often, this wait and see approach, and I see this time and time again in the comments and questions in the Q&A, is that if there's a question or concern, let's not wait and see. How we have lots of programs and resources out there that we can connect families to help them learn more about the child's development. And it's looking at that information over time that's really key and critical. We know as early childhood specialists that many children come to us with a speech delay. That's typically the most obvious, or
Yes.
something that's around their food or the way that they move. And what we know about neurodiversity is that maybe that's the starting point of being able to better understand how that child is developing. And so if we can talk about what a child's needs are and talk about what their preferred method of learning is
Yeah.
and really focus on the strengths, I think that's the way that we partner with families. There was a question here, Dr. Hollandi, and I feel like I saw it move around a little bit, but what's the difference in early diagnosis rates between children who have autism with cognitive disabilities versus those who do not have a cognitive disability or delay?
That is a great question. And if you'd seen my full slideshow, my full report on, and if you take a look at that Adam website, you will see that rates have changed over the years. We used to see initially, I guess, way back in the day, when I was younger, that autism was always co-occurring with intellectual disability. We know that is no longer true. And what the ADAM rates tell us, and I have a slide on this, if I do it expanded, I'm happy to share it, that what we're seeing, and I both nationally in Minnesota, is about 70% of children identified with autism do not have an intellectual disability. We still think, 30%, we're seeing some of that, but that has changed. So the majority of our children that we're seeing now identified with autism in the schools and clinically do not have a co-occurring intellectual disability. And so that's been a change. When I talk about the data that we're collecting shows changes over time. And certainly you may be thinking, for those of you that work clinically, well, the diagnostic, the criteria has changed a bit. We view autism as a spectrum, right? But yes, when we look at the population of children with autism, the majority do not have an intellectual disability. I hope that answered. I'm happy to expand on that, but we definitely have a whole section on that in the bigger, broader presentation.
And if we don't get to all of your questions, please add them because we're going to use this to help build out our future agendas. So please add things that you want to find out more about, areas that you want to learn more about. One of our participants, Dr. Landy, put in here, my daughter had exactly the same problem as Miguel because Spanish and English were spoken in the home. Her pediatrician said, wait and see. Her daughter was diagnosed and underwent speech therapy until she was 13. So my guess is this participant is just saying, yes, let's not wait and see. Just because there are multiple languages in the home isn't an excuse or a reason to delay supports and services. Would you add anything else to that?
Absolutely. In meeting with lots of families over the years, I mean, I've heard it all for justifying a wait and see. Certainly I hear he's a boy. Sometimes you hear firstborn boy in the family or the baby of the family, and everyone's talking for that child, and that's why their language isn't developing. I've heard because the child is learning multiple languages. What I say is, if you have concerns and you're seeing delays, continue. Do not wait and see, and continue to get help and supports. Call Help Me Grow. Reach out. What we have seen from some of our ADAM data is, and I don't always love sharing it, and we used to have more. We used to be able to do an even deeper dive, but we're seeing that somebody often brought up a concern for the children that are later identified with autism very early on. It may have been a childcare provider. It may have been a parent. It may have been a grandparent. And then we see, wait and see, fill in the blank. And I say, don't wait and see. Get more information. Call Help Me Grow. Call your local school district. We want to look. We want to get in with services and supports. I think to me, I would rather be in a position of saying, we looked at this. We got in as early as we could. Perhaps we gave some early supports. And glad we did it than saying we didn't get a chance and then looking back at those years. Intervention at any age is a gift. And so for families that wind up getting it later, yes, but we can do a lot more early on. Thank you for sharing that. Thank you for sharing.
Yeah, I'm going to just wrap up with a couple of additional comments and then we'll talk a little bit about next steps. Um, I see in the chat or in the Q&A suggestions about pediatricians or their healthcare providers. We designed this series as something that you can share with your partners in the field. So if you have a partner, whether it's childcare or school district or healthcare, that you know that you're working with that could benefit from the series, send them the link, invite them along. And we're hoping that these conversations will happen outside of this time together, that what you learn here today, that sparks an interest to say, who else in our community can support kids and families? Being smart and quirky, one of our participants said, and the late diagnosis for girls and how harmful that can be to their social, emotional, and self-esteem. We can do so much when there's a question of concern. And so any final thoughts before we go on to the next part of our session here, Dr. Holandy?
Yeah, and we'll have additional sessions where we dive a little more deeply into it, but we do know that girls are, just to that comment, often identified later. We know that children that may have a more subtle presentation are identified, and we need to kind of talk as providers, how can we work together to better address the needs of children with autism so we can get to them earlier. But we'll talk more about that in future sessions as well. So with
Thank
that,
you.
Michelle, are
Yeah.
you ready? And I'll take a look at we will take a look at the Q&A. That's so helpful. Thank you for your comments and feedback on that. And thank you for your listening. I'm gonna go to the next slide.
So our next steps are watch for an email, complete the survey, receive the attendance of certificate, and we'll provide a resource sheet. I also put in the follow along program as an additional resource for families who may not be ready for an evaluation that links them to specialized services. So again, take a look at that. Next survey or next slide, please. And there'll be more. So April 1st is our next one, and the importance of developmental screening. So that will be myself and a colleague from local public health that will share the importance of reaching out and connecting with families when they have questions or concerns around development. And what are some ways that we can do that don't feel intrusive and that can really honor family priorities in their process and journey around early identification. And then in May, we'll talk about Help Me Grow Early Intervention and Help Me Connect, our online navigation tool, or what I like to say, the early childhood Google here in Minnesota. In June, we'll talk about mental health supports because we know that neurological differences and developmental delays are often connected to behaviors that are stressful. They're stressful for the family, they're stressful for caregivers, and what can we do to support children and families with mental health needs? In July, that's not the first Monday of the month because of the holiday, so we're going to do a little veering off there. In July 8th, we'll come back together and talk about common barriers. And so we'll have partners from the field that talk about how do we make sure that our children and families can access early childhood activities along with their same age peers. And then we won't solve the waitlist crisis, right? So we all know this is a problem. So the early intervention system and healthcare coverage, also, how do we support that journey around getting a medical diagnosis and how that opens up to other supports and services, in addition to the wonderful interventions that we provide in early childhood and early intervention. Thank you so much for coming today. Next slide is just a big, beautiful thank you and just a warm welcome to attending. Dr. Hollandy, do you want to talk a little bit about the recording?
Absolutely. Thank you, Michelle, and thanks for covering all that. And again, thank you everyone for joining. Yes. So what we will do, we recorded this today and we will send it out, the survey for you to complete. As Michelle said, we are hoping to post the recording on our MinAdam website, but also I'm hoping we can post it on a couple other places that are even more accessible that we need to work out, but we'll let you know. I'm hoping, well, more to come on that. I don't want to plant that seed until we get a final answer, but we will have information as to where we'll post it so you can later view it. I know we covered a lot today and it was a very broad overview and introduction, but we are very much looking forward to this journey together in this monthly series. And we appreciate your comments and questions and feedback. And we look forward to additional feedback on the survey. I think Krista has put a survey link in the chat. I cannot see the chat right now, but we will definitely be sending it out as well. And we look forward to your feedback about what you've learned and what you'd like to learn more of. Thank you so much. And I hope everyone has a good day, and we'll see you next month in April.